Ancient Egypt, a civilization that flourished along the fertile banks of the Nile River for over 3 millennia, is often celebrated for its monumental architecture, intricate art, and profound religious beliefs. However, one of its most remarkable yet underappreciated achievements lies in the field of medicine. The ancient Egyptians were pioneers in medical knowledge, developing sophisticated practices and treatments that were far ahead of their time. From surgical procedures to herbal remedies, their understanding of the human body and its ailments was both advanced and holistic. This video delves into the secrets of ancient Egyptian medicine, exploring its origins, practices, and enduring legacy. The foundations of Egyptian medicine: a divine connection. Medicine in ancient Egypt was deeply intertwined with religion and spirituality. The Egyptians believed that health and illness were governed by the gods, and that healing was a divine gift. The god Thoth, often depicted as a man with the head of an ibis, was considered the patron of medicine and writing. He was believed to have given humanity the knowledge of healing through sacred texts. Similarly, the goddess Sekhmet, a lioness deity, was associated with both disease and healing, embodying the dual nature of medicine. The most famous healer in Egyptian mythology was Imhotep, a polymath who served as the chief architect to Pharaoh Djoser during the 27th century BCE. Imhotep was later deified as the god of medicine and healing, and his teachings influenced Egyptian medical practices for centuries. Temples dedicated to healing, such as the Temple of Kam Ambo, served as both religious centers and medical schools, where priests and physicians studied the art of healing. The Edwin Smith Papyrus, a surgical masterpiece. One of the most important sources of information on ancient Egyptian medicine is the Edwin Smith Papyrus, dating back to around 1600 BCE. This document, named after the American Egyptologist who purchased it in the 19th century, is a surgical treatise that provides detailed descriptions of various injuries and their treatments. Unlike other medical texts of the time, which often relied on magical incantations, the Edwin Smith Papyrus is remarkably scientific in its approach. The papyrus contains 48 case studies, ranging from head injuries to fractures and dislocations. Each case is meticulously described, with observations on the patient's symptoms, a diagnosis, and a recommended treatment. The text also includes a glossary of anatomical terms, indicating a sophisticated understanding of the human body. For example, the papyrus describes the brain's convolutions and recognizes the connection between brain injuries and motor function, a concept that was not fully understood in Western medicine until the 19th century. The treatments prescribed in the Edwin Smith Papyrus are surprisingly modern. They include suturing wounds, setting broken bones, and using honey as an antiseptic. The papyrus also advises against treating certain severe injuries, recognizing the limits of medical intervention. This pragmatic approach to medicine highlights the Egyptians' advanced knowledge and their emphasis on practical, evidence-based treatments. The Ebers Papyrus, a comprehensive medical encyclopedia. Another invaluable source of information on ancient Egyptian medicine is the Ebers Papyrus, dating to around 1550 BCE. This extensive document, over 20 meters long, is essentially a medical encyclopedia, covering a wide range of ailments and their treatments. The Ebers Papyrus contains over 700 remedies, including prescriptions for diseases of the digestive system, respiratory system, and skin, as well as treatments for dental problems and gynecological conditions. The remedies in the Ebers Papyrus are a blend of herbal medicine, dietary recommendations, and magical incantations. Many of the herbal treatments are based on plants that are still used in traditional medicine today, such as aloe vera, garlic, and juniper. The papyrus also includes recipes for ointments, poultices, and inhalants, demonstrating the Egyptians' knowledge of pharmacology. One of the most fascinating aspects of the Ebers Papyrus is its recognition of the importance of the heart. The Egyptians believed that the heart was the center of thought, emotion, and life itself, and they developed a rudimentary understanding of the circulatory system. The papyrus describes the heart as the source of the body's vessels, which carry blood and air to all parts of the body. This concept predates the discovery of the circulatory system by over 3,000 years. Dentistry, a painful necessity. Dental health was a significant concern in ancient Egypt, as evidenced by the numerous dental problems found in mummies. The coarse diet of bread and grains, combined with the presence of sand and grit in food, led to widespread tooth wear and decay. The Egyptians developed a range of dental treatments, including fillings made from resin and malachite, and they even used a form of toothpaste made from crushed ox hooves, ashes, and burnt eggshells. Despite these advancements, dental care in ancient Egypt was often painful and rudimentary. Tooth extraction was a common procedure, and there is evidence that the Egyptians used a form of dental bridge to replace missing teeth. However, dental infections were a leading cause of death, and many Egyptians suffered from chronic dental pain. Gynecology and obstetrics, the care of women. The ancient Egyptians placed a high value on women's health, particularly in the areas of gynecology and obstetrics. The Kahun Gynecological Papyrus, dating to around 1800 BCE, is one of the oldest medical texts dedicated to women's health. It contains information on pregnancy, childbirth, and contraception, as well as treatments for gynecological conditions such as menstrual disorders and infections. The Egyptians had a sophisticated understanding of the female reproductive system, and they developed a range of treatments to support women's health. For example, they used pessaries made from honey, acacia, and lint to treat vaginal infections, and they prescribed herbal remedies to regulate menstruation. They also recognized the importance of prenatal care, advising pregnant women to eat a balanced diet and avoid strenuous activity. Childbirth was a dangerous process in ancient Egypt, and midwives played a crucial role in ensuring the safety of both mother and child. The Egyptians used a variety of tools and techniques to assist in childbirth, including birthing chairs and herbal remedies to induce labor. They also practiced a form of cesarean section, although this was likely a last resort due to the high risk of infection. Surgery, precision, and innovation. The ancient Egyptians were skilled surgeons, capable of performing a range of procedures with remarkable precision. They used a variety of surgical instruments, including scalpels, forceps, and probes, many of which have been found in archaeological excavations. The Egyptians also developed techniques for wound care, such as suturing and the use of honey as an antiseptic. One of the most impressive surgical achievements of the ancient Egyptians was their ability to perform trepanation, a procedure in which a hole is drilled into the skull to relieve pressure or treat head injuries. Evidence of trepanation has been found in several Egyptian mummies, and the procedure was likely performed with a high degree of skill, as many patients survived the operation. The role of magic and religion in healing. While the ancient Egyptians made significant advancements in medical knowledge, their practices were not entirely scientific. Magic and religion played a central role in healing, and many treatments involved spells, incantations, and amulets. The Egyptians believed that illness could be caused by supernatural forces, such as evil spirits or the wrath of the gods, and that these forces could be appeased or driven away through magical means. For example, the Book of the Dead, a collection of spells and incantations designed to guide the deceased through the afterlife, also contains spells for healing and protection. Similarly, amulets inscribed with protective symbols were often worn or placed on the body to ward off disease and injury. Despite the prevalence of magical practices, The Egyptians recognized the importance of combining magic with practical treatments. Many medical texts include both herbal remedies and spells, reflecting the belief that healing required a holistic approach that addressed both the physical and spiritual aspects of health. The legacy of ancient Egyptian medicine. The medical knowledge of ancient Egypt had a profound influence on later civilizations, including the Greeks and Romans. The Greek physician Hippocrates, often regarded as the father of Western medicine, was heavily influenced by Egyptian medical practices, and many of the treatments described in the Ebers Papyrus can be found in later Greek and Roman texts. The Egyptians' emphasis on observation, diagnosis, and practical treatment laid the foundation for modern medicine, and their understanding of anatomy, pharmacology, and surgery was remarkably advanced for its time. While their reliance on magic and religion may seem primitive by today's standards, it reflects a holistic approach to health that is increasingly recognized in contemporary medicine. The secrets of ancient Egyptian medicine reveal a civilization that was both deeply spiritual and remarkably scientific. The Egyptians' understanding of the human body, their innovative treatments, and their holistic approach to health continue to inspire and inform modern medical practices. From the surgical precision of the Edwin Smith Papyrus to the comprehensive remedies of the Ebers Papyrus, the medical knowledge of ancient Egypt stands as a testament to the ingenuity and wisdom of one of the world's greatest civilizations. As we continue to uncover the secrets of their healing arts, we are reminded of the enduring legacy of the ancient Egyptians and their contributions to the field of medicine.